Welcome to the episode of AI Send podcast, where we explore how innovation and intelligence are transforming the future of healthcare. I'm your host, Geet Kera. Today's conversation is going to be a fascinating one, where we are diving into how traditional medical practices are going extinct. And to unpack this, I'm joined by Dr. Tran, a respected voice in the healthcare space, whose insight bridge both traditional and modern approaches to patient care. Dr. Tran, thank you for joining us. It's great to have you here. To start off, could you share a bit about your background and what inspired you to enter this space?
Yeah, so I'm so excited to be here. Actually went through the traditional path of going to medical school, residency and training to become a doctor, only to realize that I didn't want to be a doctor anymore. And that sounds kind of funny is because while I truly signed up to be a doctor to help save lives, it started to get muddy with writing prescription after prescription, answering phone calls and emails, charting, and it took over my life. And in fact, it actually took over my mental health and physical health to the point where if I kept going, I would not make it. And so to kick off this podcast, I had no business starting a business because science was all I knew. But I knew that something had to change and that I was meant for more. So literally one moment sitting in the middle of the highway, stuck in traffic at 8 o'clock at night, I decided I'm doing something different. And I had no idea what that meant. And this was back in 2012. And I became what Tony Robbins says, be resourceful. So just started looking for who can help me start a business. And this was when social media was just barely,
Yes.
there. We didn't even have Facebook Live. We
Right.
certainly don't have ChatGPT and AI now, but today is one of the best times to start a business, but to also stay ahead of the game because as you mentioned in the introduction, traditional practices are dropping left and right.
So, over the past few years, Angela, what major shifts have you noticed in practices operate or engage with patients?
Be your own personal brand. So I understand that practices want to almost systematically, scientifically do the process of what it takes to run a business from sales and marketing and the logistics. But at the end of the day, no matter what industry you are, people come to you because who you are, what you believe in, and what you stand for.
In terms of how the technology is changing, the traditional models are fading, and what is it taking over to?
Yeah, the advantage of the businesses that are moving forward are the ones that are 2 steps ahead. And it's all about efficiency. It's the fast communication. It is also the optimization using AI. How can you create a combination of technology and humanization to be right up front to take care of that customer will always win based on speed and efficiency of execution 100%.
Are you using any of kind of those formations right now in your business, or that's something you would want to, considering the whole world is going in that direction?
I admit that technology is in my DNA. I use it to advantage because I always look in my business, and we do value operations and systems up front. I always look for the repetitiveness of what we're doing. And the question that my staff are always going to laugh at me, I say, can a software take over?
From an AI perspective, how AI could help there is that you could let it do the repetitive, mundane tasks, which are not really meant for the doctors and, professionals. Those tasks can be given to a system, and then you could focus on really what the value for the customer is. So that way you can segregate and make it a good blend out of it.
Yes, there's an art form of speed to communication and then slow down to connection. I tell you, those who have mastery in those will do very well. I'm trying to say that someone has a concern, and due to their lack of their own knowledge, they're looking for an advisor expert. But there is an anxiousness feeling. We may feel like it's a simple question, but it may be a high level concern from the patient or customer point of view. Again, the timely fashion of reaching out in itself is service.
Yes.
One of our mission and values of our company, all of our staff, go by is we help patients feel safe and seen. And it can be simple as that tagline, but that's really every task, every responsibility, every habit that we do.
Customer is the key, and everything, all your values, practices, methodology, you need to circle around that.
The beauty of technology is that you have to learn how to communicate with someone, but remember that not everybody receives communication in the same way. It is still a language. So again, for example, some people are more audio. They need to hear your voice, whether it's through a phone call. Some people are visual, so they need pictures or videos. Yeah, I know that a lot of people are nervous about ChatGPT and AI, but once you embrace it and really understand how to utilize it for good, then it no longer becomes scary and it almost becomes normal. Like, I mean, I talk to Alexa and Siri all the time. We were nervous talking to computer generated voices back in the day, and now they're like part of the dinner table.
I think now the business owners are understanding that, and they want to utilize AI and want to do automation. And probably they don't know how, where, and what benefits are they actually going to get out of it. So I think that's where the bridge or the main key is. So in
Yes.
terms of the most impactful innovations that you have seen the health practices grow while improving the patient's care, what are like some of the powerful innovations that you think are there?
I mean, just the basics of social media. I know that not everybody is a fan of social media, and it is tough, for sure. I mean, who gets to do that with their doctor, right?
Mhm.
You have so many gatekeepers on hospital systems, but now it's such a personalization because I'm a medical weight loss doctor, these issues are personal. So social media, yes, it's sort of almost a love-hate relationship. However, it really allows a connection. The second thing is just the customer relationship management software. So just staying organized and, the communication back and forth, just because I mean, sometimes I don't remember birthdays and anniversaries and holidays. And how do you just organize that? But you use a software to know exactly when you talk to a patient, exactly when they've enrolled in a program, what steps they're in. It's just so meaningful. And again, when you understand, the system side of things, then it really enhances your service 100% when you know exactly where everybody is at within the point. And then again, we really, be honest with you, maybe one of the few, but we embrace ChatGPT. It just really has enhanced the language of what we do. And it helps us learn. I mean, most of the time we've had to hire people for this, and we still do, but it makes us feel like we have an expertise too, because at the end of the day, we are the experts of our own business.
Mhm.
So we've really and just embrace it. And I encourage, as a business owner, you don't have to be an expert at technology. You just have to be open to it.
I think you are already well ahead of the game, considering you are using these tools in your, medical practices and trying to see what benefits you can get out of them. So, what has been the biggest success or milestone for the company so far? What do you feel like has been over the last years?
I mean, I because I've been doing medical weight loss for so long, like over 13 years
Good.
now, it's natural for me. I am proud to say that I easily help patients lose over 50 pounds, over 100 pounds. We've even had people lose over 150 pounds. And
Mhm.
I have solidified that formula, but it's not the magical diet and exercise plan. It is the experience that has mapped out. Once you learn who I am, see me on social media, go to my website, be introduced to one of my team members. I mean, the whole mapped out process is really the milestone that I'm proud of. And again, I have been helping patients lose weight for years, even before the magical GLP-1 injections came to market. So now look at me. I can easily help patients with or without injections. And I consider those injections also a medical technology. We use that to advantage. So people just really need to understand, okay, what are the tools available? And the ones who really take advantage and utilize it, will win the race.
Yeah, yeah. And like what challenges have you faced as the company scaled and how you've kind of worked through them?
I talk to my team members all the time. Don't pay attention to the news. Just let me do it. But I'll be honest with you, every time I look on the internet or the news, there's a new announcement that changes, at least particularly in our industry in weight loss. There's an insurance that's no longer covering this medication or this or that. And we have learned as a team to pivot quickly, but also realize that just because we've changed one thing, it's never permanent, which helps the team members understand. Because sometimes the news that we see is not to our advantage. So we have to look to figure out, okay, what do we need to modify? But we always find the better way. And then we just brace ourselves for the next announcement. But I think that's what keeps us on our toes. And I think it's just the big overarching message of our discussion today on the podcast is change is the only constant. You
Yeah.
can constantly innovate. You have to be 2 steps ahead of your customer and 2 steps ahead of your own self. But that's what helps us grow. It's why it's a game, but it's fun for those who figure it out.
How many employees you have in the company?
Fluctuate. We've had as large as 17 team members. Now we're down to 5. Honestly, again, there is this marriage of technology and humanization. So I've really understood how to make an impact, how to grow my company, but also really be efficient with what I'm managing. I know that it's difficult because there are a lot of positions that are being replaced by AI, and I want to those to not be afraid. It just allows you to really step up in the human part because there will always be something that AI is missing from a human standpoint. So as long as we understand that, there is going to be a collaboration in a good way if you see it that way.
Correct. I agree with you. Human angle can never be replaced. So in terms of your admin work, like how is that? That's smooth, or you think that there is more efficiency that can have there from an
Yeah, luckily I have team members and software to offload some of that. It's still obviously a challenge when it comes to managing, your emails and communications. And we continue to improve every day, the type of thing. And so I think obviously as we continue to grow bigger, you're almost forced to really optimize admin tasks to out of that box in order to continue to stay in creativity and growth and expansion mode. Again, I feel fortunate that I am open to technology kind of person. I'm always the one to figure out there's always a faster way to do things.
So if you could just fix one thing today, like making more money, saving time, leveraging AI for efficiency with your business, what would be on your top list?
Honestly, I just want to communicate to 10 times more.
It's like your mode of reach out right now.
We do obviously a mixture of the traditional platforms. We are on Instagram. My handle is at MedFit Dr. Tran. And that's where it's very educational, but also entertaining and lots of photos and videos. Of course, LinkedIn is a little bit more of a professional,
Fun.
platform. So connecting with other executives and professionals and business owners. And so it has a different flavor. If I can just say one thing that resonates with you, then I did my job. And if I can do that in a faster way, in a bigger way, then that's really the leading of what I do with my business.
I really appreciate how you've connected innovation with the humanity. Before we wrap up, where can our listeners learn more about your work or connect with you?
They can go to my website at medfitmedicalweightloss.com. I also encourage you to don't quit, stay in, believe in yourself, believe in what you do.
Thank you, Angela. I think that's very useful advice. And for everyone tuning in, thanks for joining us. If you enjoyed the show, make sure to follow and share. See you next time.